Let's talk about diabetes. Diabetes is a global health problem that is not only financially expensive, but also demanding to the quality of life for those who have it. In Hong Kong, approximately 1 in 10 people have diabetes. There are over 700,000 people with the disease, and approximately 27,000 of that set are under 35. For adolescents, this is a very stressful disease to have to carefully manage their diet, regularly exercise, and take multiple insulin shots every day. Teenagers generally have poor compliance with their lifestyle required with diabetes, and those that do not manage the disease well risk both short and long-term harmful bodily effects. The Hong Kong Polytechnic University and Pork Oil Hospital have been working together to understand pediatric diabetes from the patient's point of view, in the hopes of improving care, to make patient care more engaging and ultimately more effective. We observed clinical sessions, held design workshops, and talked to healthcare professionals, diabetic adolescents, and their loved ones in order to get to know how diabetes has impacted them. We learned that the management of diabetes is not hard, but many adolescents who suffer from it lack motivation and willpower to sufficiently manage their lifestyle. So what can we do about it? How do we encourage diabetic adolescents to be responsible with their lifestyle and interest others to do the same? We propose to build accountability, motivation, support, and connection into the patient ecology. First, doctors and nurses generally encourage patients to hit objectives and accomplish certain actions, such as doing more exercise or eating more at home. However, these actions and objectives are usually not noted down, and there's little accountability during the next visit. Since patients already use a diary to note down their blood glucose levels, it makes a lot of sense to add a new section to their book that focuses on immediate actions and objectives that they can accomplish. By encouraging simple step-by-step actions to the patient and making these tasks accountable, the patient and doctor relationship can be more efficient and motivating. Next, SMS messages can be sporadically sent to the patient to remind them of the goals and objectives that were previously agreed upon. Connecting the doctor to the patient outside of the hospital strengthens motivation and support to act on the agreed-upon actions. Another observation we had was that diabetic teenagers did not want to talk to their parents about their disease, nor could many console their classmates and friends either. There is a clear need not only for social support from others who diabetics could relate to, but also for these adolescents to even have someone to exercise with. To solve this, doctors will now ask certain patients to meet others at the hospital. Meetup times can be arranged around existing consultation visits for those who could be benefited from an introduction, whether to be mentors, support partners, or activity partners. There will also be activities outside of the hospital. Badminton club, swim meets, running groups, all for diabetic adolescents and hospital staff to form positive relationships with one another. Not all teenagers, though, have time or will want to initially meet others in person, but rather, many are more comfortable communicating online. Because of this, there's an opportunity to initiate a virtual community as a place for teenagers to support one another, whether it is finding out the best places to exercise, plan activities, or share advice. It can not only act as a place to retrieve information, but also as a platform for collective action, to allow diabetic adolescents to become ambassadors of health to others, and to give those in need immediate access to a community of supporters and healthcare professionals so they can receive support in the moments they need it the most. This is our vision, and we hope you support us in accomplishing it.